In today's Health Alert, the CDC continues to investigate at least 109 cases of unexplained hepatitis in American children. 2 of those cases are in Metro Detroit, one in Oakland County and the other in the city of Detroit. So for more on that, we're going to bring in our chief health editor, Dr. Partha Nandi. And Dr. Nandi, should parents be worried about this?
First of all, I want to tell parents that hepatitis is not common, Glenn, in all children, and adults are most at risk for hepatitis infections, especially those between the ages of 30 and 59 years of age. That's why these younger cases are really getting so much attention. Right now, there are over 228 probable cases of unexplained hepatitis in kids in at least 20 countries. I expect that number actually, Glenda, to rise as there are over dozens more under investigation according to the World Health Organization. Now here in the U.S., 25 states and territories have reported cases. And last week, the CDC looked at clinical data from cases in Alabama, and here's what they found. 9 children between the ages of 1 and 6 had unexplained hepatitis, meaning there was no real clear cause. They were generally healthy with no underlying medical issues. Now, 3 of the 9 kids ended up with acute liver failure. 2 of them needed liver transplants. Thankfully, though, all 9 are reported to be recovering. However, of the 109 unexplained cases here in the U.S., 5 deaths have been unfortunately reported.
So if your child is vaccinated against hepatitis, is there anything to worry about?
This is a common question I get asked, right? So we have 2 vaccines, hepatitis A and hepatitis B. Hepatitis A are the 2 shots starting at 12 months of age. It protects kids and also prevents outbreaks. Hepatitis C consists of 3 shots starting shortly after birth, and this vaccine usually creates long-term immunity. Having said that, hepatitis is what? A liver infection. It's inflammation. Besides hepatitis A and B, there are 3 other specific viruses that can cause this: hepatitis C, D, and E. Now, we have no vaccines for those 3. Plus, there are other possible causes like certain toxins, poisons, and medications. There's also a type of adenovirus that the CDC has been investigating because it's been showing up in quite a few of the kids' blood work. So while there's no conclusion right now as to what's behind these kids' case of hepatitis, I would stress this, that parents make sure that their kids are up to date on vaccines, Glenda, especially hepatitis A and hepatitis B. Also, please seek medical attention if your child gets sick and has symptoms like nausea, abdominal pain, and jaundice, which is yellowing of the skin and eyes. Remember, these cases of unexplained hepatitis are very rare. But it's still important for parents to stay up to date with the current information and take action if they're concerned. Again, not to panic, but make sure you be vigilant, and if your child has some symptoms, let the doctor know right away.
All right. Thanks so much, Dr. Nandi.
My
Good
pleasure.
to see you. Thank
you.
you. And if you have a question for the good doctor, you can email him at drnandi@askdrnandi.com, or you can send it to us on Facebook or Twitter, and we'll get it right to him.